Edo State government don't call on local government Chairmos them to take primary healthcare matters serious to strengthen healthcare delivery across communities. Deputy Governor Right Honorable Dennis Idausa, will be the Chairmo of the state's primary healthcare task force, make the call for the task force first meeting for Government House, Benin City. Oga Idausa Konya say primary healthcare na the foundation of sustainable health system wey dey important for disease prevention, maternal and child health care among others, and say na im also be the first point of access to basic care. He come assure them say Governor Okpebholo ready gidigba to address all the challenges through strategic planning and accountable leadership.
This gathering represents a pivotal step in our collective mission to strengthen the PHC system in our state and improve healthcare outcome for all. The primary healthcare is the foundation of an effective and sustainable health system. It is the first point of access for our citizens, the cornerstone of preventative care and crucial determinant of overall public health. Without a robust PHC system, our community remain vulnerable to preventable diseases, maternal and child health challenges, and other pressing health concerns. The reactivation of this task force underscores our determination to address these challenges through strategic planning, effective collaboration, and accountable leadership. Our mandate is clear: to enhance primary healthcare service delivery in Edo State, ensuring accessibility, quality, and efficiency at all levels. To achieve this, we must foster a multi-sectoral approach that harnesses the expertise and commitment of all stakeholders. Local government chairmen must take an active role in prioritizing PHC within their jurisdiction. Let me emphasize on this. The local government council chairmen that are here, over time, the primary health care have been abandoned. We have not seen the previous government putting so much emphasis on this area. But distinguished Senator Okpebholo-led administration is very, very clear on this. All the 18 local government chairmen must play an active role in ensuring that these PHC centers are now functional, and we must do whatever it takes to protect. To achieve this, as the closest, as the council chairman, as the closest to the grassroots, you hold the responsibility to ensure functional health facility and proper resource allocation for sustainable healthcare improvements. I urge you to integrate PHC centers development in your governance priority. I extend my gratitude to the healthcare professionals, development partners, and technical experts who have continuously worked to advance the health agenda in Edo State. Your dedication and service have been instrumental in driving progress, and I commend your unwavering efforts. However, the reality remains the state government alone cannot shoulder this responsibility. To build an effective primary healthcare system, we must embrace collaboration, resource sharing, and collective problem solving. I call on all stakeholders to support this administration of distinguished Senator Okpebholo as we work to fortify primary healthcare in Edo State. Together, we must focus on strengthening our immunization programs, improving maternal and child health care service, and ensuring the provision of essential medical resources across 18 local government areas. This is a shared responsibility, and every contribution matter how small, will make a difference in shaping healthier Edo State. As we commence discussion and deliberation today, I encourage a constructive engagement, strategic thinking, and a commitment to actionable solution. Let us approach this task force with a determination and purpose, knowing that the future of the state healthcare system depends on the decision we make here today. I thank you for your presence, your dedication, and your willingness to be part of this transformational journey. May our effort today set the foundation for a stronger, more resilient, and effective primary healthcare system in Edo State.
Commissioner for Health Dr. Cyril Shomole for in part, Konya said the ministry targets now to build healthcare system where they functional, affordable, and responsive to the people's needs.
In Edo State, our vision is clear: a primary healthcare system that is functional, resilient, equitable, and responsive to the needs of our citizens, especially the most vulnerable. Over the past month, we have made tangible progress. We have distributed 18 new ultrasound machines to primary healthcare centers across the Central District, improving maternal and child healthcare delivery. Launched a statewide free malaria testing and treatment program now available in all government hospitals. Continued the training and retraining of healthcare workers and traditional birth attendants, ensuring best practices and updated knowledge. Completed 3 previously abandoned PHCs, bringing care closer to rural communities. Equipped fertility with ICT tools, 220 tablets and laptops to digitalize the digital patient records and enhance data-driven decision-making. Our efforts are yielding results, but we know that gaps remain. This is why today's meeting is crucial. As members of this task force, we are the brain trust, the architects and implementers of the future of the healthcare in Edo State. I'm also pleased to inform you that in partnership with the federal government, we have secured 22.69 acres of land and temporary lease to facility to establish the Federal Obstetric Fistula Center, a landmark move that will further bolster women's health in Edo State and South region. Colleagues, this is our time to act. Let us reimagine what is possible. Let us collaborate effectively and let us recommit to our shared goal, healthcare that leaves no one behind. I thank each of you for your dedication, insight, and passion. Together, we will build a stronger, healthier Edo State.
Executive Secretary, Primary Healthcare Development Agency, Sonny Osayende, salute stakeholders for their commitment to strengthening healthcare for grassroots levels.
Today marks a significant step in our collective commitment to strengthen the PHC system in Edo State, ensuring that healthcare delivery remains effective, accessible, and sustainable for all. Let me begin by expressing my profound gratitude to His Excellency, the Deputy Governor of Edo State, for his visionary leadership in revitalizing this event, in his effort to create a well-oriented, responsive PHC system. Your Excellency, we sincerely appreciate your unwavering commitment. The significance of this task force cannot be overstated. Primary healthcare serves as the foundation of our healthcare system, ensuring preventive, curative, and maternal and child health services reach every corner of our state. Our success in strengthening PHC will directly translate to improved health outcomes, reduced disease burden, and a healthier population. I would also like to thank each distinguished guest and stakeholders here present today. Our local government chairmen, traditional and religious leaders, government officials, and development partners. Your presence here signifies your commitment to this cause, and your contributions will be instrumental in shaping the future of the primary healthcare system in Edo State. I encourage everyone here to engage meaningfully into these discussions. Let us share insights, propose solutions, seek clarifications where necessary. This is a platform for collaboration, and only through collective action can we overcome the challenges facing our PHC system. Once again, I extend my sincere appreciation to each of you for making time to participate in this meeting. Together, let us build a PHC system that serves our people efficiently and ensure healthier relation for our Edo State for generation to come. Thank you, and I wish all productive deliberations.
For her goodwill message, Coordinator World Health Organization Dr. Nora Eyu Konyan the task force said them get big work to do to overcome challenges like insecurity and reach the deep areas for inside communities to ensure say they not leave anybody behind for the immunization efforts.
As a task force, we have a critical role to play, and this includes addressing challenges. For immunization, part of the challenges that we have is insecurity and hard to reach communities. Now, during campaigns, the teams find it difficult to get to insecure areas. And the implication is that our children that are living in these communities remain unvaccinated. Besides the challenge of insecurity, those people living very far into the communities. So part of what we are going to address is ensuring that we have access to deliver life-saving vaccines to the children in these remote and difficult to reach areas. So let us work together to ensure that all our children are protected against the killer diseases. Now, partners in the state, WHO, UNICEF, and others will continue to support the Edo State government to ensure that this is achieved.
The meeting brings together commissioners, local government chairmos them, representative of the World Health Organization, Red Cross, and the State Healthcare Agency. Some local government chairmos them, for their part, come share with Tori people how them see the matter on top the effort to boost healthcare for grassroots level.
Take the message back to our various local governments so that start the work with the health sector to assist them in actualizing, make sure health challenges are brought to the nearest minimum.
Facilities are renovated, stocked with research facilities for them to go to carry out effective treatment for our children and vaccination. I hope that by God's grace, everyone will get into this agenda and the instruction.
Please, can all the council chairmen please make
get the best out of what we have discussed. Thank you very much.
It was very good because it exposed all councils who are not performing well during their PHC assignments, especially immunization. We in Oregon always be at the top, and we want to be at the top. Whatever that is needed for my PHC staff, especially being headed by the PHC coordinator, will be given to them freely. Not just only that, whatever requirements or whatever thing they demanded for, without hesitance, my staffs also be there to assist them.
Make una not forget say, as we see them, now so we dey talk am, we know the take blame. From Government House, Benin City, Ekata Ojisoli, TMC News.